हेलो गुड इवनिंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के इंपॉर्टेंट क्वेश्चन। विच ऑफ द कैरेक्टरिस्टिक पैटर्न्स इन ब्राउन-स्क्वाड सिंड्रोम? कॉन्ट्रालेटरल लॉस ऑफ जॉइंट सेंस एंड पोजीशन, कॉन्ट्रालेटरल loss of pain and sensitivity. This one is the best answer because in Brown-Sequard syndrome present the contralateral loss of pain and sensation. Lateral hemisection of the spinal cord produce the Brown-Sequard syndrome. इसका ये क्वेश्चन इंपॉर्टेंट है। क्लिनिकल फीचर क्या क्या हो सकता है? इप्सीलैटरल वीकनेस, इप्सीलैटरल वीकनेस, इप्सीलैटरल वीकनेस एंड ipsilateral loss of joint position and vibratory sense. Ipsilateral क्या होता है? joint position and vibratory sense. posterior column इसमें इन्वॉल्व होता है. and ipsilateral segment होता है sign like radicular pain, muscle atrophy or loss of a deep tendon reflex. and कॉन्ट्रालेटरल क्या होता है? लॉस ऑफ पेन एंड टेम्परेचर, लॉस ऑफ पेन एंड टेम्परेचर. इसमें क्या होता है? स्पाइनोथैलेमिक ट्रैक्ट इन्वॉल्व होता है. वन ऑफ टू लेवल्स बिलो द सेक्शन, वन और टू लेवल्स बिलो द लीजन. नेक्स्ट क्वेश्चन. 35-year-old sustained a crush injury and he says his urine is brownish in color. On investigation, his urine plasma creatinine level less than 20. What could be the possible causes? Rhabdomyolysis, congestive heart failure, UTI and hyponatremia. So here the best answer is the rhabdomyolysis because the history of क्या है यहाँ पे? crush injury along with the brownish urine and the urine plasma creatinine of less than 20 is the renal AKI. क्या है ये? renal AKI which can be caused by the rhabdomyolysis in the case. rhabdomyolysis क्या है? serious life threatening condition होता है that involves a rapid breakdown of damaged skeletal muscle cell due to direct or indirect injury. If the muscle breakdown causes the renal of myoglobin which contains heme into the bloodstream causing heme pigment nephropathy. The heme pigment can cause the direct PCT injury and vasoconstriction leading to fractional exertion of sodium less than कितना होता है? less than 1. Pigmented granular cast precipitate in the tube causing oliguria and renal failure. Causative factors क्या क्या होता है? causative factors traumatic crush injury, heat stroke or malignant hypothermia, and main important excessive or strenuous exercise. Next question. A patient who is a known case of small cell carcinoma of the lung is diagnosed with the syndrome of inappropriate ADH secretion SIADH. It is characterized by evovolemic hyponatremia. Is the answer because here the syndrome of inappropriate ADH secretion SIADH is associated with increased urinary excretion of sodium, thereby leading to the evovolemic hyponatremia. Small cell lung cancer is commonly associated with SIADH due to the ectopic release of antidiuretic hormone. The excess of ADH secret lead to the gain of water. This stimulates the baroreceptor to release atrial natriuretic peptide. ANP leads to the loss of water and salt with urine sodium level of more than 20 MEq per liter in this patient. Thus the level of water reaches a steady state. Steady state means Evolemia. Steady state means evolemia. Put the urinary loss of sodium continue to occurring during the hyponatremia. अब क्लिनिकल फीचर क्या क्या हो सकते हैं? इवोलेमिया होता है यहाँ पे नो साइन ऑफ क्या डिहाइड्रेशन, नो साइन ऑफ डिहाइड्रेशन एंड हाइपोनेट्रेमिया. हाइपोनेट्रेमिया एन ए लेस देन कितना होगा 135 mEq पर लीटर. एक्सेसिव यूरिन सोडियम, एक्सेसिव यूरिन सोडियम होगा. इसका कितना होता है एक्सक्रिएशन मोर देन 30 mEq per liter and decreased serum osmolality. Decreased serum osmolality कितना होता है लेस देन 280 mSm per kg. Next question. A young patient with hepatitis E virus infection develops acute liver failure. Which of the following scores can be used in assessing the prognosis of the patient? PT score, Child-Pg score and MELD score, and both here. See, this one is the MELD score. Because here the patient with acute liver failure, MELD score and King College Hospital criteria can be used to assess the prognosis. Child-Pg score किसके लिए होता है? Child-Pg score is used to assess the severity of cirrhosis. PT score is used to predict mortality in patient having bloodstream infection. Next question. All of the following are clinical feature of Meant-to-be syndrome except mucosal neuromas, marfanoid habitus, medullary corneal nerve, and parathyroid adenoma. Parathyroid adenoma is the best answer because the parathyroid adenoma is not commonly seen in Meant-to-be or main 3. It is seen in कहाँ पे होता है main 1 and main 2A और main 2. मेन सिंड्रोम is a group of inherited disease होता है ये, resulting in proliferative lesions like hyperplasia, adenomas and carcinoma of multiple endocrine organs. Tumors occurs at a younger age में होता है. Then sporadic tumors arise in multiple endocrine organs either synchronously at the same time or metachronously at the different times. So today that's all. Thank you and keep revising.